I am one of those people that you hear about that has always known from the time I was 5 years old that I wanted to be a veterinarian, and really never changed paths along the way. Always loved science, always loved animals, and so veterinary medicine was the perfect combination of the two. As a veterinary oncologist, my clients are both the pet owner as well as the family veterinarian. It's an honor to get that referral, and I take that very seriously. We want to make sure that we deserve that honor and that we maintain that relationship. And so staying in communication with the family veterinarian, keeping them involved in the care of that patient, and if any new problems arise, making sure that the family veterinarian has the opportunity to be involved in that and follow through on it. I've been doing clinical studies here in our oncology practice, a veterinary cancer specialist, since I started the practice in 1993. My goal was to bring the research into a clinical setting so that we could really develop innovative therapies for our cancer patients, so that we could make sure that our pet owners really had the advantage of any new research that was being done. We could make that available to them so that we could advance the quality of life of their pet and also the length of life of their pet. When a pet owner comes to meet with me for the first time, there's generally a lot of anxiety about the diagnosis of cancer. That's a very, very scary term. About the quality of life of their pet, about whether they're treating their pet for themselves or they're treating their pet for them. And so a lot of what I do is really counseling and educating the pet owner about the treatments and how the treatments impact the patient. The patient really doesn't know what's going on, and thankfully, so they're living in the moment, and as long as they're comfortable, they're happy. So our goal is to keep them comfortable, and if they're not comfortable, to make them comfortable, so that the treatments we recommend, whether that's surgery or radiation therapy or chemotherapy or participating in a clinical trial, whatever therapy we're recommending it because the goal of quality of life should be met with that treatment. What I worry about are the pet owners that never come to see us. Those pet owners that never pick up the phone and make that appointment, I worry that they've not given themselves an opportunity to treat their pet, to enjoy more time with their pet, to allow their pet to have the quality of life it should have. I really believe that these dogs and cats really live in the moment, and the moment should be excellent at all times. And so when we make a decision to embark on cancer treatment, our focus is if their quality of life is good, we want to maintain that. If their quality of life is not good, we want to make it as good as it possibly can be. In some cases, treatment is not the right choice. In some cases, we're really not going to improve quality of life, and so going down a treatment path is not going to be our recommendation in that case. But if there is a treatment option that will be consistent again with the philosophy of quality of life, we wanted to make that available to the pet owners so that they can enjoy as much time with their pet as possible.